Okay, so today we're going to talk about skin and feet and how that relates to gerontology. We're going to talk about the changes in the geriatric population related to skin. Skin is the body's first defense system against injury and disease. Caring for skin is vital, especially in the aging population. Changes in the skin can occur from internal factors such as genetics or external factors such as sun, wind, and cigarette smoking. According to Tui and Jett on page 26, sun damage causes leathery texture and mottled pigmentation. Cigarette smoking increases the occurrence of wrinkles. Skin changes from aging include dryness, thickness, decreased elasticity, and the development of small blood vessels. The visible signs that a person is aging are changes in the firmness, color, elasticity, and texture of the skin. The firmness and elasticity can be shown by noticeable wrinkles. The color can be depicted by pallor and increased transparency, and texture can refer to dry or leathery skin. Thinning of the hypodermis can cause elderly patients to be sensitive to heat and cold temperatures. Now we're going to talk about the feet and how the normal changes that it can occur with that. The main change that occurs in the feet relating to aging are closely related to changes in other body systems. So according to Tui and Jett on page 28, toenails become thick and hard as well as brittle. They often appear dull and opaque as the person ages. The musculoskeletal system changes in the elderly lead to tense ligaments, tendons, and joints. Tui and Jett note on page 28 that these structures become dry, hardened, and less flexible. Cardiovascular changes include the thickening and stiffening of the heart tissue, which cause a decrease in the body's ability to circulate oxygen throughout the body. This strongly affects the lower extremities and feet, which cause a difficulty in retaining heat. Many older people often feel cold in rooms where others are comfortable, and this is directly related to that. Tui and Jett state on page 34 that the peripheral nervous system changes include tactile sensitivity. This means that there is a decrease in the connections of the nerve endings to the skin. The decreased sensitivity translates to delayed reactions. An example would be an older adult sitting with their feet next to a heater. They may not realize how hot the heater is and may receive burns on their feet without noticing it. So the next thing I wanted to talk about is pressure ulcers. There are a lot of things that occur abnormally in the aging person, and these can include pressure ulcers as well as skin tears, purpura, which are large purple spots, and xerosis, which is excessive dryness. There are 4 stages of pressure ulcers, which will be discussed further in this video.
This is the game.
Sorry, there's going to be an ad now.
Pressure sores, also called bed sores or decubitus ulcers, are regions of skin that break down when you sit or lie in one position for too long. These wounds occur most frequently in areas where your bones are close to the skin, including your heels, ankles, hips, tailbone, or elbows. Constant pressure to one of these areas compresses the blood vessels that supply your skin with oxygen and vital nutrients. Without a sufficient amount of blood flow, your skin cells eventually die, and a pressure sore forms. Pressure sores are categorized by degrees of severity. A stage 1 pressure sore is reddened, inflamed, and does not blanch or become pale when pressure is applied. A stage 2 pressure sore appears as a blister or an open sore. The area surrounding the sore may be red and irritated. A stage 3 pressure sore involves a full thickness loss of skin that appears crater-like and extends to the layer of fat beneath your skin. Stage 4 is the most severe. A stage 4 ulcer is a full thickness wound that extends down to the underlying muscle or bone.
Okay, so now we're going to talk about assessment, specifically of the skin. It is important to assess skin turgor regularly to aid in determining if a patient is dehydrated. If the skin recoils immediately, then dehydration is not present. Dehydration can cause the skin to become excessively dry, also known as xerosis. The skin can crack and bleed, leading to an increased risk of infection. Nurses should always assess for skin tears on older patients. Skin tears occur as a result of frail and thin skin and can happen very easily. The skin should be assessed for abnormal lesions because the likelihood of skin cancer increases with age as a result of increased sun exposure. Older adults should also be assessed for bruises and lacerations regularly. Tui and Jett state on page 26, due to delayed inflammatory response in elderly, inflammation may not begin for 48 to 72 hours after the injury. Bruises and lacerations may be warning signs of abuse. It is important to discuss with elderly patients about whether or not they feel safe. The next thing I wanted to talk about is skin cancer, just because it's something that personally is important to me in my life. All the people in my family on my dad's side have been affected by skin cancer, both my aunts, my grandma, and my grandpa, as well as my dad. My mom hasn't had it, so it's just on my dad's side. No one in my mom's family has had that happen. But skin cancer is the uncontrolled growth of abnormal skin cells and occurs when unrepaired DNA damage to skin cells triggers mutations that lead to skin cells to multiply rapidly and form malignant tumors. Next, we're going to talk about the assessment of the feet. It is important to assess the feet for signs of injury. When a patient is experiencing neuropathy due to reduced tactile sensitivity, injuries may occur without the patient even noticing. If a patient has diabetes, it is even more important to assess for injury because of diabetic neuropathy. Not only can diabetic patients not always feel and notice injuries, but their healing is also delayed, more so than the other elderly people that do not have diabetes. It is important to assess the toenails and determine if they are cracked and brittle. Cracked toenails may increase the possibility of infection. Assess the feet for range of motion. Many older adults may have arthritis in their hands and feet, making walking difficult and painful. If a patient has difficulty walking, consult with PT to determine if the patient needs an assistive device such as a walker to ambulate safely. Alright, next we're going to talk about the pathophysiology. So we're going to talk about the changes in gerontology and relating to decreased elasticity. As people age, many changes occur in the skin. The collagen fibers in the skin stiffen. The collagen fibers are a protein fiber that give strength to the skin. Elastic fibers can also degenerate, causing decreased elasticity, and the subcutaneous tissue decreases. When all of these changes are combined, wrinkling occurs. And I added a picture of my grandparents. Another change that occurs is the flattening of the junction between the dermis and the epidermis. When the bond between these two layers weakens, skin tears and other trauma to the skin occur often. As a person ages, melanin is produced less. This causes the epidermis to become thin, which can lead to greater visibility of bruises and blood vessels. Over time, the tone of a person's skin lightens due to reduced number of melanocytes. With less protection from the sun, sunburns and therefore skin cancer can be more likely to occur. Vertical ridges and toenails occur when there is a decrease in the amounts of water, calcium, and lipids in the body. When the circulation of oxygen in the blood is decreased, there is a reduced blood and oxygen supply to the feet, which causes a slow growth rate of the nails. Next, we're going to talk about the education. So due to a reduction of melanocytes in the epidermis skin layer, sunburn from UV rays is very common in the elderly. It is imperative to teach patients to apply sunscreen before going out into the sun. Damage that is recurring to the skin can increase wrinkles, dryness, and the possibility of skin cancer. When an elderly patient is still able to ambulate but has decreased sensitivity in the feet, they may kick objects without realizing they did so, or not realize the extent of the injury. Families should ensure that the patient is wearing house shoes when ambulating. They should encourage the use of an assistive device if necessary. The family should also make sure that there is no clutter in the house for their family member to trip over. When assisting an older patient with ambulation, it is important to be gentle on the skin. Grabbing a patient's arm or shoulders while walking may cause bruising or skin tears. Teaching the family about the use of a gait belt can reduce injury for the patient. Elderly patients can burn their feet without realizing it when sitting next to a heater. Nurses should teach both the patient and family members to watch out for burns on feet and not allow a heater to be running for an excessive amount of time. Aging skin tends to become very dry easily. Patients should be taught to use fragrance-free lotion daily, especially after showering. This will help to keep the skin moisturized and reduce the likelihood of the skin cracking. So that was my presentation. I appreciate you guys watching. These are my references, just for you to see. Most of the pictures in this presentation I took myself or my family members took. And that should be it. Thank you.